Our solution and aim was simple: to develop a medical technology in cannulation with our Airglove device for a positive impact in healthcare for patients in not only the UK, but worldwide. The patented Airglove solution is both disruptive, yet it's very simple. It uses temperature-controlled air within a disposable glove to warm the arm, dilating the veins and improving cannulation success with ease of use, reducing procedure time, cross-contamination, and improving patient outcomes. To date, we have completed trials in over 100 NHS hospital trusts, including a patient service evaluation at Maidstone and Tunbridge Wells Hospital.
My experience of using the Airglove is quite vast now, because we've had it for quite some time. I think we've had it for almost 18 months, the unit that we have. And I introduced it initially as a pilot within our oncology unit, and was really encouraging the nurses to give it a go for patient comfort, really. And now, you know, we reach for the Airglove whenever we can, because patients who come into our cancer centre can have many issues around cannulation. One being needle stick, you know, or cannulation phobia. So they're frightened of actually having cannulation performed on them before their treatment, which brings some negative emotions to the actual situation. You have people who have physical problems in terms of their vein structure.
And it's really difficult sometimes to actually put a needle in to be able to give them medication or even life-saving drugs, fluids. So very early on in our training, we often sometimes tap the limb. We either flick the limb with our fingers, you know, try to get it to come out a bit. Or sometimes we actually use a hairdryer, and we warm the arm up, and we try to get some venodilation that way.
That it benefits both the patient and the nurse, because the nurse can sometimes feel very anxious about missing the vein if it's the third or fourth attempt, because they know that the patient's getting anxious, and actually it can result in the patient not having their treatment for the day. So there's quite a lot of pressure on a nurse to cannulate the patient for treatment. And what we've found is that if we immerse the patient's hand in hot water, it can sometimes help to expand the vein, which means it's easier to cannulate the patient. But since we've had the Airglove, we've found that patients actually prefer the Airglove because they don't have to put the hand in water. It actually, the hand stays warm for longer with the Airglove. And we have less attempts at cannulation when we use the Airglove, because the vein is in such a lovely condition. To get to a sink to put the hand in hot water, you have a risk of burning or overheating the water. You have a risk of infection in that way around the sink. So our infection control team are very happy for us to use the Airglove. What I've found against the water immersion is that the arm actually stays warmer and the veins are plumper for longer. So against, by the time the patient has walked back from the sink and sat down and the nurse has got ready, that the hand has generally cooled down quite significantly.
You maintain sterility, you can maintain the temperature, because there are settings there that will maintain the temperature at the comfortable levels, three levels. Whereas when you use water, you can't control temperature. So it's not just in cancer chemotherapy, but it's in almost every aspect of hospital care. You will invariably need to take blood from patients.
Our nurses, who are very experienced in cannulation, are asked to go to other areas of the hospital where the patient is finding, or the person who's trying to cannulate the patient, for example, in the CT scanning department. If they find it difficult to cannulate the patient, they will sometimes ask for us to go up there.
There are many acute situations where you need to get a needle in, to a cannula in, to give life-saving drugs. The most grave thing is, of course, when a patient is brought in either at a trauma center or myocardial infarction. And I've spoken to cardiologists who actually think that this might be very useful in the cardiology unit. I've also spoken to some colleagues in the renal unit who think that this might be of use to renal patients who also have, problems of getting a needle in.
The bottom line is, whenever a patient needs to have a vein punctured for either for obtaining blood for sampling, or to cannulate the patient for a multitude of reasons, being drugs, for treatment, things like that, it could be used anywhere.